right, so I'm back. Actually, I never left. I just need to finish getting ready from the last video. That other video was just so long. So this video is about me going to meet with the oncologist, okay? So I went to meet with the oncologist and she was telling me what my options were. First, she told me about the type of cancer that I had and how it's confined to the milk ducts right now. At that moment in time, she was like, I don't know if it's moved anywhere else or done anything else. I had come to her with a list of questions, and one of those questions was, are you gonna do another mammogram or another, ultrasound before you go in there? Like, are you gonna go check it out before you go in there to see if it did spread or if it did do anything? And she said no. So she's just gonna go in there and just see what she sees. My scalp is so dry, I gotta oil it up real quick. Dry scalp. And I'm using this Carol's Daughter Goddess Strength. She told me about my options that I had. So I could either get a lumpectomy, which now is called breastcancervaing surgery, where they just take out the piece of cancer that you have, and then you have to do radiation therapy and hormone therapy after. I can do a partial mastectomy, which is where they just take one boob. I could do a full mastectomy where they take both of the chi-chis. If I do the partial or the full, then I can get reconstruction done at the time of the surgery. They will take out the chi-chi and then they'll replace it with something. What that something is, I don't know. I need to meet with a plastic surgeon. So they can do a fat transfer possibly, but when I asked her about that, she said that she didn't think that I had enough fat to do that. They could do implants. So there's different kind of implants that I can get and do with that. Oh shit, it's crazy up in here sometimes. She was giving me my options. She told me that with the mastectomy, then there is a possibility that I could lose my nipple, which sounds really crazy. Just to have like a chi-chi with no nipple, that sounds kind of wild. But that's a possibility of something that can happen. And I guess it's a high possibility, because I'm like, what in the world? Because I had looked up some pictures of some mastectomies and it just looked like the women were butchered. And it's like, why does it have to be like that? Like, why do they just cut you straight across and it just has to be like that? Like, there has to be another way. There just has to be. So I have so many questions about that, because I found different things that I think that they could do for me, like a nipple saving mastectomy, or I don't know, something else. She also told me that she wanted me to go get some genetic testing done to see if I have the BRCA1 or BRCA2 gene, because if I have that gene, then she's going to suggest that I get a full mastectomy. But if I don't have that gene, I don't know what her recommendation will be. I don't know. Let me just do it like this. I don't know what I'm doing. Okay, anyways. She wants me to meet with the plastic surgeon in the meantime to discuss what my options are as far as implant, fat transfer. The fat transfer is called a deep flap surgery. And that one, they just cut the abdomen and then they just take a piece of that and they put it in your chi-chis. But when I asked her about that, that's when she said that she didn't even think I had enough fat to do that. We also talked about if it was outpatient or not, like would I have to stay in the hospital? So I would not have to stay in the hospital. It is an outpatient surgery no matter which one I choose. If they take the full, no matter what the surgery is, they take the full breast, they take one breast, they do, a piece of it, then I'm in and out in a day. We also talked about recovery time. If they take both chi-chis or even one, then it will be about 2 to 3 months recovery time, opposed to if they just take the piece, then that could be several weeks. She told me that if I do the breast conserving, I would have to do both radiation and hormone therapy. So the radiation therapy, based off what I researched, because I didn't even really go into that with her, she just told me I would need to do it. But based off the research is 5 days a week. So Monday through Friday. And I've seen people have to do radiation therapy like 20 sessions. So what is that? A month? 5, 10, 15, 20? Yeah, so like a month every day, back and forth to the hospital doing radiation therapy. If you get both the chi-chis gone, then you don't have to do the radiation therapy, but you still have to do the hormone therapy. So with both of them, you have to do the hormone therapy, which she said can be taken in pill form. So I was asking her, does the hormone therapy make your hair fall out? She said, no, it doesn't. It's just like I'll have hot flashes and stuff. I'm just sucking at curling my hair today. I also asked her, what is the likelihood of it returning? And she said, if I keep the breast tissue and only remove the little bit of cancer, the possibility of it returning is higher. She said higher is 0.5 to 1%, opposed to if I remove the whole thing. The chance of it returning will be lower because I don't have breast tissue. I asked her if it was an aggressive cancer because when I looked it up, it said, Google said that it was an aggressive cancer because the positive tumor nuclei was 30% or higher. So my positive tumor nuclei is 30% based off the lab results. So I'm low-key a little bit nervous that some stuff may be going on in there right now while I'm waiting to get it removed, but I don't know. Oh, and that's another thing. She said that when she goes in there, that 20% of the time she finds additional cancer in there. So they could go in there, send it off to the pathologist. There's a 20% chance that I could have more cancer than what they thought or what they saw on the scans. And this could also be true since I have dense breast tissue. They could have not seen it all. I asked her if I needed to do chemo. She said that I do not need to do chemo, which is great. She also told me that I need to take my birth control out. I currently have Mirena IUD, which is a T-shaped object that's inserted into your uterus and releases small amounts of hormones. Since my cancer has hormone receptors, then I can't have any hormones or be taking any hormones while I'm going through this treatment and trying to get this cancer gone. So I need to swap that out for a different type of birth control. She said that with people my age, she takes a more aggressive approach to getting rid of the cancer. It's just all these freaking different variations and all these things. It's just a lot. It's a lot to think about and a lot to, decide on. But for me, like my main thought when I first found out that I had it, then I immediately was like, I just need to get these things gone. Like they need to go away. I don't need them like that. I can replace them with something else because I don't want to not have anything. My initial thought and my initial plan was to get rid of them and then just replace them with something else because I do not want to have to deal with this later on in life. Even though there is a chance of it still coming back, like in the chest wall or, somewhere else. But I would like to think that I did all that I could do. Like I just went straight to the end. I just take out the lump and then it comes back, then I'm going to need to take the whole chi-chis anyway. So it's like, why not just take the whole chi-chis now, get that over with, and just pray for the best. I don't want to be like, oh, dang, is it going to come back? I got dense breast tissue. Are they going to find it? Am I going to be as lucky next time? Are they going to find it early enough? Like there's just all these things just going through my mind. I think that if I were to just eliminate them, then I think my mind would be put more at ease. It's still going to be nerve-wracking because if I have to get an implant, then I am low-key nervous about that as well because, that's something that you have to deal with and take care of and, get swapped out at a certain stage or a certain point in time. So, that's something there too, but I just don't know. It's just so crazy. It's like you get like some cancer and now you got to decide you just going to take it out or take off your titties. Like, what are you going to do? Oh my God. So I think there hasn't been anything yet that has made me think otherwise with regards to removing the whole thing. It's gonna be weird if I lose my nipples. It's gonna be weird. It's definitely gonna be weird. If I do go the route of removing, then I would just get the same size that I have now. I wouldn't go smaller, I wouldn't go bigger. I feel like that would just be an additional change that I wouldn't want. So right now I'm a double D cup, so I would just keep that. I would just stay right there. Like, no need to go smaller, no need to go bigger. Just take it out and replace it. That's it. Overall, my appointment with the oncologist went well. It was very informative. I got all my questions answered that I had, which is good. I later looked her up and found out that she is the chief of general surgery at Loma Linda, so that made me feel a little bit better. I still need to talk with the plastic surgeon to see what my options are there and see what he's talking about. I was able to find a little bit of information on him, but not as much as I would have liked. So I do want to go and see some before and after pictures and some pictures of his breast reconstruction and all of those things. And I would also be willing to let him, you know what? I just thought about this right now. So Grey's Anatomy is a teaching school, right? So Loma Linda is a teaching school as well. So I was wondering if they would be able to record it, because I would love to watch it later, to record it and use it as a teaching thing. Like, if they could use that as a teaching thing, I would love that. And what I was going to say prior to me just thinking about that is that I would allow him to use my pictures as a before and after if he wanted to use those, just so that he could show other women, because I didn't see, that many pictures on there. I'm willing to help in any way that I can with this, but I want them to help me. Like, I don't want to be walking out of there with no butchered titties, because that is crazy. But yeah, I will come back and let you guys know what the results were of the genetic testing for the BRCA1, BRCA2 gene. And I think that is it. I will see you guys in the next video. Bye.